Good evening, I'm Anthony Shembry and I'd like to welcome you all and thank you for joining us here tonight to launch the St Vincent's Current Foundation fundraising campaign to raise $5.5 million for a new dedicated bone marrow transplant ward at St Vincent's Hospital, Sydney.
I was diagnosed with acute myeloid leukemia on the 9th of November 2010. Yeah, got my blood test done in the morning. I was admitted to hospital that night.
He said to me, the good news is you're 17 and you have leukemia, but the bad news is you're 17 and you have leukemia.
The bone marrow transplant procedure is for people who have life-threatening blood disorders. Most of those blood disorders are cancers, particularly things like acute leukemia. And without having the bone marrow transplant, the disease would take their life.
When we do transplants, we're really aiming for cure, and in those cases, at least half to 2/3 of those patients can be cured.
Now, this procedure is dangerous. It's dangerous because the treatment involves the blood counts of the patients being suppressed for a number of weeks, and their immune system being suppressed for months, sometimes even years. So in that situation, there's a high risk of complications. And one of the major complications we're seeing today are resistant infections.
Apart from the infection side of things, from a patient's perspective, if they have their own room, it's more comfortable for them. It's a very stressful, long journey for them. And if they can have their own room, there's the component of privacy and feeling like they can deal with things and talk confidentially to their family members. It's much easier in a single room than it would be in a 4-bedded room, for instance.
A new transplant ward would just be absolutely fantastic. It's something we've wanted for such a long time for our patients. A new layout with single rooms would provide better privacy, better dignity for our patients who can be with us for up to 3 months at a time.
It was the toughest few weeks of my life. Right. No matter how much of the morphine pump that I was pumping into me, no matter how much of it I pushed, it wouldn't really reduce that at all.
It's a really long journey and it's just very intense, and having your own space and your own room is actually, I guess, quite important. Your privacy at these times is paramount, and having to, I guess, share that with other people isn't ideal.
What we will see are patients who receive the most up-to-date care. We will see patients housed in an appropriate, safe environment where the risk for infection is minimised. And these patients are at high risk for infection. We need to do our utmost in order to prevent those infections. And if we do that and patients can leave hospital healthy, as most of them do today, but we can still improve, then we will have done our job and the community will have done its job.
I've been at St Vincent's for over 20 years now, and I've seen a number of wonderful developments. We've become much better at doing transplantation. The risk of dying from the procedure now has diminished greatly. But we're now facing a big challenge, and that is the development of these resistant microorganisms. And one of the major ways we can overcome that challenge is by creating this new ward which will help protect patients from that complication.
It's thanks to people like Dr. Dodds that I'm alive today, right? And my nurses and my social workers. But if we get them the facilities and the proper foundation that they need to actually give the proper care that they know how to give, it will make it so much better for a lot more people.
St Vincent's Hospital prides ourselves on staying at the leading edge of patient care and research, and your support tonight is vital for our ongoing success. Thank you.